you okay?
He's a doctor, Beth.
That's fine.
She just threw up.
No, whatever was in there that wanted to get out did. Now I'm good as new.
How about a quick exam?
How about I have an event in 10 minutes? I'm fine, Dr. Hank.
On a scale of 1 to 10.
15. Maybe 16.
Do you have fever, abdominal cramps, rapid heart rate?
Just an ad for some old person drug?
Look, if it's food poisoning, it can get a lot worse than just throwing up.
Beth just gets nervous before she competes.
I don't get nervous, I freak out.
Well, do you usually throw up when you freak out?
My dad says I internalize through my stomach.
Where is your father or mother? I'd like to speak with them.
Oh, Beth's dad is a stable manager. He's probably around somewhere.
Well, I'd like to get his sign off.
My event's in 8 minutes. They're not gonna take a doctor's note if I'm late.
All right, your heart rate is fine. I can give you something to calm your stomach, and hopefully you're freaking out.
Hey! What are you, what are you doing?
It's okay, Dad.
I'm Dr. Lawson.
I don't care who you are. You have no right to give my daughter anything without my permission.
It's just something to settle her stomach.
Beth was sick, Mr. Samuels.
You're not sick, are you?
No, Dad, I'm fine.
Okay, so why are you here?
Because I was told your daughter was ill.
Thank you, Madison.
Dad, she was just trying to be nice.
Yeah, I'm sure that she was. Can I talk to you for a second? Look, I know that it looks like the cover of Town and Country around here, but riding is cutthroat and competitive. Beth is a target because she's good at what she does. And she's not like these other girls.
Your daughter threw up.
She gets nervous before she competes. She has since she was a little girl. Look, I know you're trying to be helpful. Beth doesn't need a doctor to settle her stomach. What she needs is a blue ribbon.
Good luck in your events, Beth. I'll be rooting for you.
Thanks.
How's Beth doing?
She seems okay. You know her?
She's a local. Her father's a stable manager here.
Yeah, you'd have thought he was a doctor. He was so in my face when I was giving Beth a checkup.
Dan's a bit overprotective and not the easiest man.
Yeah.
Then again, he hasn't had the easiest time either.
Something happened.
There were rumors about a drug scandal a few years ago, but he denied it. He used to train all the locals and the wealthy ones during the summer, but now it's just Beth.
What type of drugs?
I'm not sure about the details. Just something about performance-enhancing drugs was an issue.
Are you in pain?
It's just the pain of humiliation. Did you lose consciousness? No.
All right, she just had the wind knocked out of her.
And you know this because...
Whoa. What are you doing? What are you doing?
Following spinal injury protocol.
If we move her, it could be dangerous.
Okay, midline cervical tenderness. We need to get her boarded and collared immediately.
I'll get
Beth,
aboard.
just stay still for me.
Okay, we don't need the board.
I'm not asking.
Guys, I feel okay, really.
All right, we've ruled out spinal injury. Now we just have to clear you for a concussion.
My head doesn't hurt.
You should sit out the rest of the show.
Okay, she said that her head doesn't hurt.
What if Beth is sore tomorrow and doesn't feel like riding?
She'd ride right now if she could.
I won't let her. We don't have a clear picture of her neurological status. Let's get her up.
Okay, why don't we ask Beth what she wants to do?
I want to compete. I feel okay, really.
I believe you, Beth. But symptoms of a concussion can present themselves at any point in the first 24 hours. So let's see how you feel when you wake up tomorrow. Let's get her off the table. I still need to check her blood pressure, her reflexes, and I'll need a urine sample.
What? What? Why exactly do you need a urine sample?
Well, for starters, I want to make sure Beth's kidneys weren't affected. If there's blood in her urine, it could indicate renal damage.
Okay. Yeah, have you ever worked one of these horse shows before? You don't really know much about the sport, do you? Riders fall all the time.
No, my specialty isn't horseback riding, it's medicine. And if you want Beth to compete, you need me to sign off.
Yeah. You know what? I guess I just don't like you very much.
Dan, the feeling is mutual.
I'm pretty sure that Beth doesn't have kidney damage. And I'm pretty sure you're thinking the same thing.
Yeah, well, pretty sure isn't good enough.
You're checking her urine for drugs, aren't you?
Send a sample to Hampton's Heritage for a tox screen and...
Put a rush on it?
Yeah.
House calls at midnight. You must be the best doctor in the world, or you really don't trust me to monitor my own daughter.
Well, I'm concerned about her.
Okay, her vision isn't impaired, her speech isn't slurred, she isn't nauseous, she isn't dizzy. So, please, get the hell out of here.
No matter where I go, Beth can't ride tomorrow without my consent.
You don't like me. That is fine. Do not take it out on Beth.
Are you doping your daughter, Dan?
What are you talking about?
Beth's tox screen. She has dextroamphetamine in her system.
Well, that's not possible. Beth isn't taking any medication.
It's typically prescribed for ADHD. It's considered a performance-enhancing drug, Dan.
The lab made a mistake. Somebody did. Get out of here.
I know about your previous scandal.
That was about horses. It wasn't about people, and it didn't involve drugs. It involved capsaicin.
Chili pepper?
I put it on the horse's legs as a pain reliever until some expert decided that it made the horses jump the fences higher and decided to ban it. I would never dope my own daughter. Now get the hell off my property before I help you off of it.
My dad didn't do anything. I did. I took the drugs.
You what?
Madison gave them to me. She takes them for her ADHD. I didn't take that many, and I won't do it again, I swear.
After all that we've been through, how could you take that risk?
I've just been really tired and spacey lately. I needed something to keep me focused. I couldn't miss this competition.
And now you will miss it.
What?
Because I don't care what anybody says, you're not riding tomorrow.
Dad, no. I have to compete. I've worked too hard. Tell him I'm okay, Hank. Tell him.
I'm sorry, Beth, I can't. Beth? Why are you dressed like you're going to ride?
Because I am. All you have to do is clear me.
Your father doesn't want you to compete, and I can't clear you.
Listen, even with yesterday's fall, I'm only 2 points away from qualifying. Please, Dr. Lawson.
I wish I could, Beth.
You don't understand. This place used to have a training school. My dad ran it, and he was so happy. And then the rumors started, and parents stopped sending their kids. If I win first place, people will want to train with him again.
Look, that's a big burden for you or anyone to take on. I am sure your dad will be just as proud of you next year. Just, please, take the helmet off. Are you okay then?
I felt like snap this helmet on off like a billion times.
Here, let me...
You've done enough, thanks. I've just been really tired and spacey lately.
She's having seizures. Beth told us she was taking the dextroamphetamine because she was exhausted, and I think she was exhausted from having the seizures.
I've never seen her have a seizure, not one. I would know that.
Not necessarily. There are many types that are impossible to detect. Beth may not even be aware she's having them.
How can that happen?
There are simple partial seizures. One of the symptoms is jamais vu.
Jamais vu?
Yeah, it's the opposite of déjà vu. You feel like you're performing a task for the first time, despite the fact that you've done it countless times before.
You've seen this with Beth?
Yeah, yesterday when she was fixing her saddle, and then I saw it again just a few minutes ago. Beth was trying to take off her helmet. Isn't that Beth's horse?
This way, okay.
What's happening?
She's having a seizure. A tonic-clonic seizure. It's like an electrical storm in her brain.
Why? What happened?
Fatigue, stress, adverse drug reaction, maybe a previous fall.
Help her, please.
Hold her gently, okay? We have to let the seizure run its course.
Why is it taking so long?
Dan, she's gonna be okay. The convulsion should stop soon. When she comes to, she'll be tired, maybe a bit disoriented also. She should get that EEG as soon as possible.
Of course, of course.
Great, I'll call the hospital.
Beth, you okay? Oh. Thank God.
How you doing, Beth?
Oh, woozy. The beam of light is gone.
What beam of light?
It's common for people with this condition to have visions, auras.
Why didn't you tell me about this?
I was afraid to keep me from riding. I just want to ride.
You will. The seizures can be controlled by medication. You will lead a completely normal life.
You hear that? You're gonna be okay. And you can keep riding. That's great news, isn't it, baby? You don't have to keep riding. It's whatever you want.